We've seen many posts on Facebook about Aetna coverage now that MCH and Aetna are not coming to an agreement. There's good news, but there's also some bad news.
Aetna customers may have some changes coming around the corner.
Aetna had purchased a company called Coventry. With that purchase, Aetna had decided to access the Coventry contract, which meant $1 million loss to Medical Center Health System annually, which was a loss that we certainly couldn't absorb and wouldn't expect the folks in Ector County to absorb as well.
Director of Patient Financial Services, J.R. Edmiston, says negotiations about rates are at a stalemate.
To issue a notice of termination that's effective June 30th. Provided that that actually does come to date, we will certainly become an out-of-network provider for Aetna.
Many customers we spoke to and saw on Facebook were frustrated with the changes. Some even went on to say they were going to switch hospitals. But there is some good news.
So anyone who is covered under Aetna can certainly still receive services. A caveat that is that they may have a higher out-of-pocket expense.
However, there's one question Edmiston is asking.
What's more important, the difference in the cost or going to see my doctor? I would certainly ask them to reach out to Aetna to say, hey, we want our hospital to be in network.
We reached out to Aetna and have not yet heard back.
Edmiston says that they still could come to an agreement before June 30th, but if not, Aetna will become an out-of-service provider for MCH. In the newsroom, Sarah Strackhouse, CBS 7 News.